MC. He just left publicity.
Well, afternoon to everyone. All right. I just want to tell everyone thank you for coming here. Again, my name is Jim Sua. I'm the MC for this program. So, Refuge Place International official donation of 44 oxygen regulator in response to the second wave of COVID-19 Liberia. Venue for the donation, star base. Time for the donation 12. First on the agenda, we have remark on behalf of the CEO by COS. Sales Translator, Young Folk.
Anyway, as the MC rightly said, I am Mrs. Presenter Young Folk, the Chief of Staff of Refuge Place International. I stand here on behalf of the CEO, Dr. Mosoka P. Fala, who allowed to be here on this day to carry on the donation himself. But since he's not in the country, he has asked us to proceed on his behalf. Ministry of Health official here present, member of the Incident Management System IMS, Private Health Sector Association, friends, member of the Full Estate, ladies and gentlemen. We first want to thank the government of Liberia under the leadership of His Excellency Dr. George Manawia for the continuous fight against the deadly COVID-19 pandemic in Liberia. The investment made in this star-based treatment center is a great testament of the commitment. When the team first came to assess star-based for this purpose, about 17 months ago, it was all forest with dilapidated buildings. But with funding from the government and partners, we can boast of this modern treatment center. We also want to thank the Ministry of Health, the National Public Health Institute of Liberia, NPHIL, and the entire incident management system for their tireless effort in responding to one of the elusive viruses in the existence of humanity. They have managed to protect the country from the first and second phase of the pandemic. Sadly, the most of Africa, the team is faced with the daunting task of containing the third wave with the harder transmissible and virulent Delta variant. When our founder and CEO of Refuge Place International, Dr. Mosoka P. Fala, heard about the intensity of the third wave, he felt that he needed to emulate the example of the Indian diaspora, that by mobilizing resources from around the world to support the COVID-19 response in India when the country was hit badly with COVID-19 in April 2021. Taking lessons from the Indian Diaspora Initiative, he made appeals to friends, his former university, partners, to support the COVID-19 response in Liberia through Refuge Place International. Some of his friends and partners heard the appeal, responded in money and supply. We have raised the initial 50,000 United States dollar, or $8,500,000 Liberian dollars from the Royal Family Charity Foundation to support different aspects of the response. We also received donation of 150 regulators for oxygen cylinder from the former university, from his former university in the state, the University of Kentucky, as well as Friends of Liberia, former Peace Corps volunteer to Liberia, other friends and partners. Not too sure of the regulators who work, they sent the first two on DHL in early July. Once they were proven to be the right size, the donors sent the first batch of 44 regulators. A second batch of 90 regulators will be arriving in the country this week or early next week to support the treatment units and hospitals across the country as determined by the incident management system. Dr. Fada wants to use this opportunity to challenge other Liberians in the diaspora to join forces in their different localities to buttress the COVID-19 response activities of our national government through the Incident Management System, IMS. The Executive Director, Mr. Joe Macaulay, will give the breakdown of our support and response activities. Liberians are strong. Liberians are resilient people. And therefore, we will defeat COVID-19 as we have defeated Ebola before. Thank you.
All right. Thank you so much, COS, for that great remark on behalf of the CEO. Now we welcome on stage remark from our PR, Liberia, Executive Director in person, Mr. Juma Kony.
Thank you very much. So my name is Joe Macaulay, and I'm the Executive Director for the Refuge Place International, a non-governmental organization based in Liberia, and it's been established now in Freetown, focusing on zero death to mothers and children. Distinguished ladies and gentlemen, on behalf of the Chief Executive Officer and the Chief of Staff that I'm joining to say thank very much to the government and people of Liberia under the leadership of His Excellency George Weah for all of the tireless efforts this government has shown in response to the COVID-19 pandemic. We at Refuge Place International also want to thank the Ministry of Health for their tireless efforts in coordinating the efforts of all of the partners in the country in response to this pandemic. We also want to thank the National Public Health Institute and the entire incident management system for their leading role in the responses to fight the COVID-19 pandemic. Also, from our side, we want to thank the nurses, the doctors, the midwives, the cleaners, the security officers at this star base, and all other treatment centers in the Republic of Liberia for their dedication in this direction. Their dedication have contributed a lot to saving many lives that we see today who fell victim of the COVID-19. Today, we are here to donate 44 oxygen regulators. As we all know, if you have the cylinders filled with oxygen, you need to have a regulator to determine the flow of oxygen as required by the patient. And if we don't have that, I'm just showing you this. It's an oxygen regulator that delivers 10 liters to the patient. It means the flow is much higher than the 5 liters that you may have around here. And that gives the patient the appropriate amount of oxygen that they need to improve their respiration while suffering from the condition. So, in addition to that, we are also donating 10 buckets to the center. We are also donating 10 bags of rice so that it serves as a little token of appreciation for the staff working here. We all know hygiene is one of the key components of this response, and so this bucket will be used in order to improve hand washing practices around here. In addition to this, ladies and gentlemen, the Refuge Place International is also committed to bring in additional 90 regulators that will again be donated to the Ministry of Health to supply or to support the treatment centers around the country. The Refuge Place International has also committed 50,000 United States dollar that will be used to produce masks, to produce some drums, to produce jingles, to produce flyers, brochures, community awareness activities be carried out at various communities within Monrovia and parts of Liberia. And this money, as we speak, is already in country, and the program has been planned, the work plan has been designed, and will start to be implemented beginning today as we speak. This program is a part of that work plan. Ladies and gentlemen, on behalf of the Refuge Place International leadership headed by Dr. Musoka Fala, we want to thank you very much, and this is the little contribution that the organization has at the moment, in addition to those that are supposed to be coming. Thank you very much.
All right, thank you, Edie, for that great remark. So now we take remarks from Dr. Lincoln from FKF Federation of Liberia.
Oh, yeah. Thank you very much. The Director, Emergency Response Unit, Ministry of Health, the Executive Director and team of RFPR Liberia, the senior management team and staff of the staff-based treatment unit, members of the press, ladies and gentlemen. It is a pleasing duty for me to be here today to witness this handover ceremony of 44 regulators to the staff-based treatment unit, the nation's referral center for the clinical management of the severe cases of COVID-19. I represent the Healthcare Federation of Liberia, a membership-based organization that was established in 2019. The mission of the Healthcare Federation of Liberia is to advocate on behalf of the private health sector, facilitate public-private partnership, and maximize opportunity for efficient cooperation among stakeholders in the private health sector. The Healthcare Federation of Liberia is collaborating with the government of Liberia through the Ministry of Health to improve quality, access, and equity to essential health services for the Liberian populace. This donation of the 44 regulators to the staff-based treatment unit is a demonstration of the collaboration with the Ministry of Health and the private health sector. We would like to express our profound gratitude to the Refuge Place International Liberia for this well-deserved and timely donation in support of the government effort to decrease the COVID-19 related deaths. We would also like to commend Dr. Musoka Fala for his efforts and relentless drive to support the COVID-19 control efforts. Dr. Fala's overwhelming desire to see a significant decrease in the COVID-19 related deaths at the staff-based treatment unit led to the mobilization of these 44 regulators, which are critically needed for patients in severe acute respiratory distress. We are informed that an additional 90 regulators are expected in country this week through the efforts of Dr. Musoka Fala.
These additional regulators will be distributed to other major health institutions in the country that cater to severe COVID-19 cases. Dr. Musuka Fala has demonstrated that his love for country supersedes any personal reward through his continuous support to the prevention and control efforts of COVID-19, even after being relieved of his position as Director General of the National Public Health Institute of Liberia. It is hoped that many solid professional Liberians will emulate such level of patriotism exhibited by Dr. Musuka Fala. To the senior management team and staff of the Star-Based Treatment Unit, we would like to thank you for being of service to your country at this very critical period, and hope that these regulators will facilitate your ongoing quest to decrease COVID-19 case fatality rate. I thank you.
Call your name, please. Your position.
I'm Dr. Lincoln, the health program manager at the Healthcare Federation of Liberia.
Full name.
Dr. Adams Lincoln, you will get a copy of this. I will give you a copy. I'll send it by email.
All right. Thank you so much, Dr. Adam Lincoln. Now we take representative from the Ministry of Health, Mark.
Good afternoon to all. Thank you all for coming. I want to give a big thanks to Refuge Place International for this very important donation of 44 oxygen regulator. This now is one of the most important medical devices in the country that we really need. I want to say thank you guys for the donation, and with information gathered, additional 90 will be coming into the country. I want to say thank you for that, and almost close to 200 oxygen concentrator will be coming in through them. I want to say thank you very much for the donation. This will carry on a very long way. Even after COVID, we'll be able to use these devices on regular patients. And I want to say thank you to the CEO and the whole management on behalf of the Ministry of Health and the IMF. Thank you very much.
Your name, sir.
Your position. Mark Luke, Director of Emergency Medical Response.
Symbolic presentation.
No, come behind here.
Yeah, he can. Shall we present?
Symbolic presentation.
Okay. So now it will be the time to hand over the donations to the Star-Based team and the Ministry of Health. Thank you. The Star-Based team and Ministry of Health, please come over, and then our COS and the ED will be able to hand over the 44 regulators and the rest of the material.
I want to say once again, thank you to Dr. Fala and the here to present the regulators. So you, on behalf of our PR, in helping to control the issue of COVID-19 in our country. Thank you.
Look here now.
Thank you. All right. So we'll take remark from Dr. Doe, head of Star-Based team.
So I'm Dr. Ibrahim Evajami, on behalf of our medical director, Dr. Doe, and the brilliant, ever-potent team here. We'd like to say a big thank you to Dr. Fala, who has always been in our vineyard, helping us and pushing us to higher heights. We pray that all of these will be used for internal purpose, we will save lives. And like your logo says, zero mortality to those who are coming here. Thank you very much.
Thank you so much, Doc. So at this movement, we take benediction from my Elizabeth. My Elizabeth. Let's bow.
Our most gracious and Heavenly Father, we thank you for this opportunity today, for this new day that you have given us. Father, we pray for your power and your spirit, so we can live together as one people. We should be in the vineyard for others to be happy. Thank you for this donation. It came from you, Daddy God. Thank you for the CEO. Thank you for the lives of the Liberian people. We thank you. Give you the glory. Thank you, Jesus. In your name we pray.
Can we take a picture, please?
And so that's all the time we got to be with you on this podcast. You're watching Spoon TV Live. We are here at Starbase Treatment Center, where the Refuge Place International just made a donation of respiratory regulator or oxygen regulator, sort of food, non-food items. So I say thanks for viewing. Thanks to all of our viewers again. And this is how let us say goodbye from my end.